So you've had back surgery because of sciatica and that pain has come back and now you're terrified. And this is understandable and I get it because I was on the same boat as you. I had gotten back surgery. I had gotten a lumbar microdiscectomy because of a disc herniation I had at L5-S1. I had radiating pain going down the left side of my lower body, pretty much from my hamstring down to my toes. I had pain at levels where I could not sit without being in extreme pain, could not walk without extreme pain, and also could not sleep through the night. So had surgery. Now, if you're watching this video, you were probably on the boat where you did that, the surgery part, and things should be better now. And maybe they felt better, and then you had a reoccurrence of that sciatic pain, and now you're going through a tough time. Is this something to worry about? Now first, full disclosure, I'm not a medical professional. I'm not a physical therapist. I'm not a doctor of any sorts. I'm a personal trainer. So what I'm going to be talking about here is just my experience because I have experienced reoccurrences of sciatic pain since getting surgery. So I just give you some context here. I still have my discharge papers. I had surgery March 9th, 2020. So right now we are in November of 2024. So we're going on 5 years since I've had surgery. I just got done lifting weights. Today I did bench press, overhead press with the barbell, also barbell rows. So a lot of things that are back heavy beginning of the week, same movements, but also with squats. I also train Muay Thai and I spar during the week, and I'm 40 years old, so not a young individual. So just from that, this can tell you, at least for me, I have been able to remain active, even though I had some reoccurrences of sciatic pain come up, sprinkled throughout since I first had surgery. Now, when I first got surgery, I was in extreme pain that first week. About 3 weeks later, I had a reoccurrence of that similar sciatic pain and I was terrified. I was worried if maybe somehow I re-herniate my disc. That eventually worked itself out. So if you're within that first 6 weeks, your situation may be different from mine, but you're going to experience some of that sciatic pain coming back. Of course, talk to your doctor if you experience it. Now, for my situation, that was not a bad sign. It was just a part of recovery and it worked itself out. Now, after getting surgery, after recovery, on the 7th week, I got right back to exercising again. When I was recovering during that first 6 weeks, I was walking even though I was in pain. Week 7, like calisthenics, I slowly worked myself back up into weightlifting. I got to a point roughly a year later where I was squatting in the 400s, deadlifting in the 500s. I bring up those lifts because those are the ones that tend to be affected the most if you had spine surgery in that L5-S1 area, so in like your lower back. So I got back to becoming pretty strong for me. I don't do PEDs, I'm not on TRT, I'm not on HRT, none of that. I'm just an old guy who lifts weights. Now, I did have a reoccurrence of extremely bad sciatica. This might have been, I don't know, maybe 2 years maybe after surgery. Me and my wife, we went on a trip to Austin, Texas. We're here on the East Coast. And I had a little bit of sciatic pain. Caught the flight, I forget if it was 4 or 5 hours, but the next day I had extremely bad sciatica. So it felt the way it felt when I knew I needed surgery. Radiating pain going down the left side. And it was weird because it wasn't like I had a deadlift or squat session that I remember at least where I was like, uh-oh, I think I did something weird. If that did happen, I don't remember it. But next day, a lot of pain. I had a hard time walking, I had a hard time sitting, I had a hard time sleeping. I was terrified. I was ready to just, I'm not going to lift weights anymore, or squat and deadlift, not lifting heavy. It's anything to get out of this pain. I was going through it. Because as you all know who are going through this right now, it hurts. It hurts a lot. And it's scary because you want to be able to at least live a normal active life where you can at least go for a walk and be able to sit down on, your own couch without being in pain and having to always adjust your body every 5 seconds because you're in so much pain. So I was there again. It took roughly 3 weeks for the sciatic pain to go away. And it did go away without any surgery, without any physical therapy. Now, initially, I tried some acupuncture. I don't think that works at all. I was in so much pain, I was willing to try anything. So called my doctor, and I was prescribed some prednisone. So they gave me, I think, the 5 or 7 day pack of prednisone. Took that, brought down inflammation. Sciatic pain started going away. 3 weeks later, no more sciatic pain. I'm back to regular life. I'm still lifting weights, squatting still, deadlifting still. Now, from that point up until now, I've had small reoccurrences of sciatic pain. Not the kind where I was having a hard time sitting or walking or sleeping, but that sciatic pain where, I would have a squat and deadlift workout, and depending on, maybe I didn't use enough intra-abdominal pressure or whatever it was, I noticed it and I said, ooh, okay, something's going on there. Maybe I'll ease up a bit. So whenever that would happen, I would take off a week from squats, deadlifts, get back into it, start light, work myself back up. But nothing that was extremely worrying like the incident that happened in Austin. I'm still not sure what the cause of it was. But from that time up until now, and it's been many years, maybe 3 years or so, I haven't had another reoccurrence in my lower back that had me terrified, that required me to take any kind of medication. All I've had since then was I noticed my back a little bit time and time again. So, what I'm saying is, for my situation, even though I had that really bad reoccurrence, and then I've had little smaller reoccurrences, it did not stop me from still being able to lift weights and for me to be able to be very, very active. Now, there are some things that I do now that are different from what I did those first couple years, the first 2 years after getting back surgery. One thing, I no longer do barbell deadlifts from the floor. Maybe I'll get back into them again, but since I'm not into powerlifting anymore, it's not a requirement for my goals. I do still squat. Right now, I just started really working my way back up. So, I'm into the 300s right now, squatting, no sciatic pain whatsoever. And what I did to be able to get back up there is I've been making extremely small jumps. This has been a long time as I've been slowly working myself back up. Starting with the bar, right? And then I'm going to 95 pounds, and then going to 135. Then from 135, I have literally just been adding 5 pounds. So you can see how that took so long. But my thought around this, and this is not medical advice, but my thinking around this, because for a lot of us, we have really strong legs, but then in the back, and you had a piece of that disc removed, it's for many of us, it's not going to be as strong as our back. So you might have legs that are strong enough to handle whatever your load was. I'm pretty sure if I put 4 something on the bar, I could 1RM it. But my lower back is not there yet. So I've been doing very small increases. That way my lower back can become stronger as attempting to catch up to my legs. And that's worked extremely well for me. I don't have reoccurrences. I haven't had a reoccurrence of sciatica to any degree since using that method with my squats. As I said, I don't deadlift anymore. I may try this method with it if it gets back on my radar. I'll make a video if I decide to do that. I can run, which is something I could not do when I was going through sciatic pain. And, I've been able to run for the past 2 years. As I said, I also train Muay Thai, which is very, very active. So I'm getting punched. I'm getting dropped. I'm throwing kicks, knees, elbows. There is nothing in Muay Thai that I have not been able to do, even though I've had that back surgery. So, if you're worried, of course, first talk to your doctor, because if you have a situation where they can take a look to make sure everything's good, go ahead and do that. But what you may find is that it will work itself out. I hope that was helpful. Again, I'm Coach Antoine. I'm a 40-year-old guy, no TRT, back to lifting weights, also doing Muay Thai, basically sciatic pain-free. So if I was able to get there, many of you will be able to get to that other side again as well. All right, don't forget to like this video. It helps out a lot. I'm a super, super tiny channel. Also subscribe if it was helpful, and leave a comment. I do appreciate that, and I will do my best to get back to anybody who leaves one. Hope you have a great day.